Hello everyone and welcome back to Clinical Cousins YouTube channel, where today we're going to discuss how the atria and ventricles turn an electrical message into an actual heartbeat or a heart squeeze. So how do we turn on the heart's light switch and then tell it to squeeze? Well, let's look at our graph, which has time on the bottom and then millivoltage on the sides. So these atrial and ventricular cells, these myocytes, they're happy to sit and rest and do nothing for a little while. I've drawn one here to actually illustrate, and it's color coordinated to show what's happening in this graph. Well, I said that these guys are okay, they're lazy. So we say that they have a resting membrane potential, meaning that while they are resting, their membrane, their cell skin has a potential, or really a voltage of about -90. So while they're resting, right here, their cell skin is charged at about -90. This is the resting membrane potential. We call this phase 4. It's pretty flat because there's not many ions that are moving in or out of these cells at this time. But then something happens. You know, if you watched the previous video, that the SA node sends its action potential message from afar, and then all of a sudden these cells start filling up with these sodium cations. So these sodium positives eventually bring the cell up to threshold, and they cause a depolarization. Remember, a rapid rise. The cell is becoming more positive, and we call this phase 0 depolarization, or upstroke. So when the cells reach a certain voltage, it triggers the sodium channels to fling open, and all of a sudden sodium comes rushing in the cell. When the cells are most positive, they trigger potassium channels to open. So potassium, it naturally wants to leave the cell, so it does, which makes our cell just a little bit more negative. So this initial potassium efflux, remember efflux leaving the cell, is called phase 1, or initial repolarization. But this is where something kind of weird happens that makes it different from the SA and AV nodes. The cell is so positive that it also opens up our L-type calcium channels. So calcium naturally wants to enter the cell and make it more positive. So what do we have? Well, we have potassium here in blue. It's leaving the cell, which makes it more negative, at the same time that calcium is entering the cell, which makes it more positive. So we have a negative force by potassium leaving, and we have a positive force by calcium entering. This creates a balance, a plateau. So we call this phase 2, also known as the calcium plateau. Well, why would we even have this plateau in the first place? Why would we even include it? Well, like we said, calcium is entering our cell, and we know that calcium is needed for contraction. Specifically, we know that calcium is needed to trigger the endoplasmic reticulum to release a calcium shower for the heart to contract. So this calcium plateau serves as a way to prolong the cell's action potential, meaning that it will contract for longer, it will not beat as fast, and it will also allow calcium into the cell so that that calcium can bind to troponin C and squeeze really, really hard. So you can see that this plateau is essential, and it's very good that we have these calcium plateaus in the atrial myocytes and the ventricular myocytes. So eventually though, our cells get tired of this and the calcium channels close. Now what do we have left? All we have is that potassium is leaving our cell. Positive potassium is leaving our cell. The really pretty potassium girl that we had, she's leaving. So what is our cell? Our cell is now sad. Our cell is going to become more negative. So what do we call this? We call this phase 3 repolarization. Repolarized is becoming more negative. So eventually the cell will return to our baseline, which we know is called phase 4. It's the resting membrane potential, until this cell is stimulated again and again and again. Now this is how the atrial and ventricular myocytes are stimulated to contract by pacemaker cells. And I hope that this video made it just a little bit more clear for you. And as always, thank you for taking the time to learn with us today, and I hope that you like and subscribe for more content. Thank you.